CDC, viruses tend to spread more commonly in the fall months, right? Winter months too, especially when you think about things like cold, respiratory viruses, flu, RSV, things like that.
So we have Dr. Judy Wiltsey here. She is from Health Partners, and we're going to talk a little bit more about the differences between the three and the vaccines available. So, doctor, thanks for joining us.
Yes, absolutely.
Well, what is RSV?
So RSV, and we talked a little bit about this last year actually, is a virus that, and you and I are sort of the cold-like symptoms, but in kids really under even 2 and older adults, it can make them really quite sick. It can sort of get into the lower respiratory tract, make it hard to breathe. You get lots of mucus, and it's a virus, so there's no antibiotic I can give you, and you sort of just have to fight through it.
And that's why recommendations are to get the vaccine if you can, but
Yes.
sounds like that's a big question mark right now too.
You know, it really is. So this year there's 3 new, and I'm going to call them immunizations for RSV. 1 for our older patients, so it's available for patients 60 and up. But there's some thought that needs to be put into whether you have other, serious health conditions. So I do recommend anybody talking to their doctor about that. As far as I'm aware, that is still available. There is a maternal vaccine that just in the last few weeks has been available now, and that's given somewhere between 32 and 36 weeks of pregnancy, and that's to give mom antibodies that she passes on to the baby, because those little kids really are at high risk, right? So I think that's a great thing, and I'm really encouraging anytime I talk to a mom to have them get that. And then in my world, the fun new thing is something called Nirmizovab, and that is actually it gives you passive immunity. So we're actually giving you the antibodies, right? And we've been doing this a really long time for those really high-risk babies, those like 24, 26 weekers. But now we have something that is available to all infants, and the recommendation is 8 months and younger. The unfortunate thing for this season is that there's really not much supply. So I think some places still have it available for kiddos 11 pounds and less, so those very newborn babies. So look for it. If you're having a new baby, look for it. Go talk to your doctor. But also good hand hygiene, avoiding those big, events and stuff with your little kiddos, because unfortunately not everybody's gonna be able to get it. But hopefully next season, more will be available.
Makes sense.
Okay, let's talk a little bit about COVID boosters, because that's something that we're getting a lot of emails about. I just had my annual physical with my doctor, and his advice to me was, if you're going to get the flu shot and you're going to be in the doctor's office, you might as well get the COVID vaccine.
Yeah.
What is the stance? Who needs the COVID vaccine?
Yeah.
How effective is it? Who are you guys recommending it for?
Yeah, so the recommendation is still that everybody 6 months and older gets a COVID booster, right? So COVID is sort of like influenza, where it is continuously sort of mutating, right? So there's new strains. Influenza does the same thing, which is why we have that yearly flu shot. And it still appears to be pretty effective at decreasing the risk of sort of severe illness, hospitalization, and death. So we're still recommending everybody get it. For kids 5 and older, into adulthood, it's just 1 dose of the booster, whether you've had another vaccine or not. And if you've had Moderna, you can get Pfizer. If you've had Pfizer, you can get Moderna. Or there's Novavax, which is not an mRNA vaccine. It's sort of like our other typical routine vaccines, if that's something that interests people. For little kids, we still recommend 2 to 3 doses and sticking with the same type of vaccine.
Yeah. Okay.
With the COVID vaccine, I'm not hearing. I'm hearing from people that they're like, I don't. Should I get this? Do I need to get this? Why do you think that is? Because people are like, okay, how many times are we gonna have to keep doing this?
How many vaccines am I going to get every year?
Right. Well, and I think that as the virus has mutated, some of it is people are getting less sick, right?
Yeah.
But there's still plenty of people that are getting really sick and in the hospital, and there's still a lot we don't know about long COVID. And the thought is really that, that protection you get from the vaccine is a much safer protection than from just getting COVID itself, right? And still is preventing some of those serious effects, even if they're not happening quite as often. And yes, I do think probably, it won't be up to me, but probably it's going to come along yearly, just sort of like the flu, since we know that it's going to continue to mutate, and as a respiratory virus, we're going to see more of it in the winter.
And it'll be a booster thing you'll just continually do.
And just because you get it the vaccine does not mean you won't get COVID.
Absolutely. Same thing with influenza.
Yeah.
Same thing really with RSV.
Okay.
But I can say getting the flu shot every year, right? I've gotten the flu, and you get a sniffly nose for a day instead of 7 days of fever.
Yeah, what's the scoop with this year's flu vaccine?
Yeah, so flu vaccine, definitely recommending that sort of in everybody as well. Again, 6 months and older. And so for our patients 65 and older, there's actually a high dose vaccine. So we recommend for most patients getting that instead of the sort of standard, because it's just shown to really boost their immunity a little bit more, and they tend to be at a little bit higher risk of getting really sick from influenza. And then they're also for kids 2 years to patients 49 years of age. And we've had it around now was there for a while, not for a little bit, now back for several years, the flu mist.
Oh, yeah.
So especially for those patients who are really like needle phobic or like, I just really don't want a shot. It's a spray that goes in each nostril, sort of like if you were to use saline nose spray or, a nasal steroid. And as a pediatrician, it's great, right? Because your 7-year-old is like, I don't want a shot.
I'm sure from your perspective.
And you're like, how about we just spray a little water in your nose? And they're like, okay.
Right.
There is some different contraindications to that versus the flu shot. So you always want to discuss it with a healthcare provider. And some places have it, some places don't, but that's always an option as well.
What are you seeing in the office right now as far as illness the most? Are you seeing flu? Are you seeing cold? Are you seeing RSV?
Yeah, so in the general office, we don't test a lot, right? Just because if I'm not going to change what I do to you, I don't always test you for things.
Yep.
But I definitely am seeing RSV. And I've definitely gotten some reports of positive influenzas in the ERs. So it's coming. I mean, there's also lots of negative tests for people who are having whatever other viruses out there that are having cough, runny nose, that kind of stuff for weeks. So, I mean, I think it's reasonable if you're not having fevers, you're not having trouble breathing, you're slowly getting better, to give yourself a couple of weeks before you worry about needing to be seen.
Yeah.
Has the RSV thing changed? Because I guess I always thought it was little kid, like babies. And then last year we started hearing more of school-age kids who were getting it, and then adults who were getting it. It's not always. Has it always been like that?
It has always been like that.
Okay.
So it's a little confusing because we always talk about it in that 2 and under, because those are the kids that in general just flood the hospitals, right? Because when we're older, again, it's usually a cold. We don't need oxygen. We don't need somebody suctioning our nose out. We don't need those supportive cares. So that's who we always talk about it in. But unfortunately, that immunity to RSV goes away over time, right? And so we don't keep it. So we can continually get infected throughout life. And we sort of forget about our older adults who can get really sick with it.
Sure, makes sense.
I have a harder time fighting it.
Yeah.
Doctor, thanks for good to see you.
Yes,
Good luck with
absolutely.
Thanksgiving.
Good to see you guys too. Thanks.
As always, if you have questions about the health of anyone in your family, please consult your doctor. We posted contact information for Health Partners clinics on MinnesotaLive.com.